Imagine this. Your loved one, your friend, or even a stranger on the street suddenly collapses, struggling to breathe. Their skin is cold and clammy, their lips and nails turning blue. Time is ticking away, and every second matters. What would you do? In the midst of the opioid crisis, this scenario is becoming all too common. But there's a way you can help. It's called naloxone, and it's a life-saving tool that's making a difference in countless lives. Welcome to this video about naloxone, a powerful ally in the fight against opioid overdoses. The opioid crisis has been a growing problem worldwide, with millions of people affected by addiction and overdose. In recent years, it's become more vital than ever to understand and utilize naloxone, a medication that has the potential to save lives by reversing the effects of an opioid overdose. In this video, we'll explore what naloxone is, why it's so important, and how you can use it to help someone in need. So stay with us as we dive into the world of naloxone and learn how we can all be a part of the solution to this devastating epidemic. What exactly is naloxone? Naloxone, commonly recognized by its brand name Narcan, is a medicine created specifically to counter the life-threatening impacts of an opioid overdose. Even though naloxone has been around since the 1970s, it has gained more attention in recent years because of the opioid crisis. It's a safe and efficient tool that has rescued numerous lives since it first came on the scene. Naloxone's main goal is to quickly reverse the respiratory depression that can happen during an opioid overdose, which is often the leading cause of death. It's crucial to remember that naloxone isn't a cure for opioid addiction, but serves as an emergency measure to stop fatalities in overdose situations. To understand how naloxone works, we should first understand how opioids affect our brains. Opioids like heroin, morphine, and prescription pain relievers such as oxycodone attach themselves to opioid receptors in our brains and central nervous systems. This connection leads to various outcomes, from pain relief and a feeling of euphoria to the potentially deadly slowing down of breathing. Naloxone operates as an opioid antagonist, meaning it challenges and displaces opioids from their receptors. In doing so, it swiftly reverses the opioid's impacts on the respiratory and central nervous systems. Naloxone has a powerful attraction to these receptors, allowing it to push out the opioids and take their spot. Nonetheless, it's vital to be aware that naloxone's effects are temporary, usually lasting between 30 to 90 minutes. Opiates versus opioids. A question that comes up is, what is the difference between opiates and opioids? Before diving into naloxone and how it works, let's answer this question. These terms are often used interchangeably, but have different meanings. In simple terms, opiates and opioids are both types of pain-relieving drugs, but their origin and composition are different. Opiates are natural substances derived from the opium poppy plant. Three common opiates are morphine, codeine, and heroin. Opioids, on the other hand, include both natural opiates and synthetic or semi-synthetic substances that are designed to act like opiates. Opioids can be either made in a lab like fentanyl and oxycodone or derived from opium poppy like morphine. In a nutshell, all opiates are opioids, but not all opioids are opiates. Opiates are natural substances from the opium poppy plant. While opioids cover a broader category that includes both natural and synthetic pain-relieving drugs, they work by attaching to opioid receptors in the brain, helping to relieve pain and produce a sense of euphoria. Naloxone is used to treat overdoses by both. Who should have naloxone handy? Considering its life-saving capabilities, you might be curious about who should carry naloxone. The truth is, a wide array of people can benefit from having naloxone nearby, as its use isn't restricted to trained professionals. High-risk individuals. Those who use opioids, whether prescribed or illicit, face a higher risk of experiencing an overdose. This group includes people with a history of opioid addiction, or those who have recently gone through detoxification or finished a treatment program. For these high-risk individuals, having access to naloxone could be the difference between life and death in case of an overdose. Loved ones of opioid users. Friends and family members of opioid users should also think about carrying naloxone. They are often the first to witness an overdose and can quickly administer the medication. Possessing naloxone and knowing how to use it allows them to act fast and potentially save a loved one's life. First responders and community members. In addition to those directly affected by opioid use, first responders like police officers, paramedics, and firefighters ought to carry naloxone. These professionals are frequently the first to reach an overdose scene and can use naloxone to stabilize the person before further medical care is provided. Moreover, community members such as teachers, social workers, and even concerned citizens can gain from having naloxone close by. Many communities offer training programs to teach people how to recognize the signs of an overdose and administer naloxone, creating a support network for those in need. The bottom line is that anyone in contact with individuals at risk for opioid overdose should think about carrying naloxone. By doing so, they contribute to a safer community and help fight the devastating impact of the opioid crisis. How do you get naloxone? Now that we know who should have naloxone, let's talk about how to get it. There are several ways to acquire this life-saving medication, making it more convenient for those who need it to keep it nearby. Over the counter at the pharmacy. In many parts of the United States, naloxone can be bought over the counter at pharmacies without a prescription. This makes it simpler for individuals, friends, and family members of opioid users to get the medication without needing a doctor's appointment. Be sure to check with your local pharmacy to find out if naloxone is available over the counter in your area. Community programs and resources. Lots of communities have recognized the significance of naloxone in fighting the opioid crisis and developed programs to make it more accessible. These programs often offer naloxone at low or no cost and may include training on how to spot an overdose and administer the medication. Some programs are specifically designed for high-risk populations, such as people experiencing homelessness or those with a history of substance abuse. To locate a program near you, reach out to your local health department or search online for naloxone distribution programs. With a doctor's prescription, one can get naloxone. Naloxone can be prescribed by a healthcare provider. If you or someone you know is at risk of an opioid overdose, it's crucial to discuss obtaining a naloxone prescription with a doctor. In many instances, healthcare providers who prescribe opioids for pain management will also prescribe naloxone as a safety measure. Acquiring naloxone is becoming more accessible. By making sure that at-risk individuals and their support networks have access to this life-saving medication, we can help lower the number of opioid overdose fatalities and create safer communities. Spotting an opioid overdose. To use naloxone effectively in an emergency, it's important to know how to recognize the signs and symptoms of an opioid overdose. Quickly identifying an overdose can help save a life, as administering naloxone in a timely manner is crucial for a successful outcome. Here's what to look for. Pinpoint pupils. One of the most noticeable signs of an opioid overdose is small constricted pupils, often called pinpoint pupils. This happens due to the opioid's effect on the muscles controlling the size of the pupils. Unconsciousness or drowsiness. Someone experiencing an opioid overdose may become unresponsive, fall asleep, or lose consciousness. They may be hard to wake up or unable to respond to stimuli. Breathing difficulties. Shallow, slow, or irregular breathing is a common sign of an opioid overdose. In some cases, breathing may stop completely, creating a life-threatening situation that needs immediate action. Choking or gurgling sounds. During an overdose, a person may make choking or gurgling noises, which can indicate a partially or fully blocked airway. This might be due to a decreased level of consciousness or the effects of opioids on the respiratory system. Limp body. Muscle weakness or limpness is another sign of an opioid overdose, as the drugs can cause a decrease in muscle tone. Cold and clammy skin. Opioid overdoses can lead to reduced blood flow, causing cold and clammy skin. This is a sign that the body is having trouble maintaining its core temperature and circulation. Discolored skin. Due to lack of oxygen, the skin may become pale or bluish, especially around the lips and nails. This is a critical sign that the person needs immediate medical attention. Being able to recognize these symptoms and signs is the first step in responding to an opioid overdose. If you think someone is experiencing an overdose, it's vital to act quickly and follow the right steps to help save their life. Acting on a suspected overdose. Once you've spotted the signs of an opioid overdose, it's crucial to take immediate action. Time is of the essence. Call 911. The first and most important step is to call emergency services. Even if you have naloxone on hand, professional medical help is still required, as the person may need additional care or multiple doses of naloxone to stabilize their condition. Administer naloxone. I'll put a link to a short video on how to administer naloxone in the description. There are two common forms of naloxone: nasal spray and injectable. And be sure to follow the specific directions for each type to ensure proper administration. Keep in mind that naloxone's effects are temporary, and the person may still need further medical assistance. In both cases, after giving the first dose of naloxone, keep monitoring the person's condition. If they don't show signs of improvement within 2 to 3 minutes, administer a second dose, alternating nostrils for the nasal spray or using a different injection site for the injectable version. Inform the first responders about the number of doses given when they arrive. Aside from calling 911 and giving naloxone, you should also do the following. Keep the person awake and breathing. If possible, try to keep the person awake and encourage them to take deep breaths. This can help maintain their oxygen levels and prevent further complications. Lay the person on their side. If the person is unconscious or semi-conscious, lay them on their side in the recovery position. This helps keep their airway clear and can prevent choking if they vomit. Stay with the person until help arrives. It's important not to leave the person alone while waiting for emergency services. Stay with them, monitor their condition, and be prepared to administer additional doses of naloxone if needed. Provide as much information as possible to the first responders when they arrive, including what substances the person may have taken and any doses of naloxone already given. By acting quickly and following these steps in response to a suspected overdose, you can help save a life. Check out this next video you might like.